Sandostatin LAR is now available in a new formulation that offers benefits for the healthcare professional and the patient. This video will review the simplified technique for mixing and administering this new formulation. As with the previous formulation, the vial contains the Sandostatin LAR powder for suspension. The new vial adapter eases preparation by enabling the suspension to be mixed while the syringe is attached to the vial. This results in an efficient mixing procedure. The needle is now 20 gauge, which is the smallest available needle gauge for somatostatin analog injections. Lastly, the syringe, with safety needle attached, helps protect healthcare providers. To prepare for mixing, bring the Sandostatin LAR injection kit to room temperature. This should take approximately 30 minutes to 1 hour. Once the kit has reached room temperature, place the package on a clean, flat surface and peel off the lid film from the blister tray containing the injection kit. Detach the flip-off cap from the vial containing Sandostatin LAR powder. Next, clean the vial stopper with an alcohol swab, taking care not to touch the rubber stopper after it has been cleaned. Now it is time to attach the new vial adapter to the vial. Peel off the lid film of the blister tray containing the vial adapter, but do not remove the vial adapter from the blister tray. Holding the blister tray, position the vial adapter on top of the vial and push it down fully so that it snaps in place, confirmed by an audible click. Grasp the blister tray by the top. With a vertical movement, lift the blister tray off of the vial adapter. To transfer the solution into the vial, first pull the cap from the pre-filled syringe and screw the syringe onto the vial adapter. Slowly push the plunger all the way down to transfer all of the vehicle solution into the vial. Let the vial stand until the vehicle has wetted the powder. This should take between 2 and 5 minutes. Meanwhile, begin to prepare the patient for injection. While standing, the plunger rod may rise if there is a slight overpressure in the vial. This is normal, so do not be concerned if it happens. After the wetting period, press the plunger all the way back into the syringe. Keep the plunger pressed and shake the vial moderately in a horizontal direction for approximately 30 seconds. After 30 seconds, check visually that the powder is completely suspended in the vehicle. The suspension should appear uniform and milky. If the powder is not completely suspended, repeat the shaking for another 30 seconds. Once the powder is completely suspended, it can be drawn back into the syringe. Turn the syringe and vial upside down and slowly pull the plunger out to draw the entire contents from the vial into the syringe. Unscrew the syringe from the vial adapter. It is now time to administer the drug. To administer Sandostatin LAR, we must first attach the safety needle to the syringe. Screw the safety needle onto the syringe and pull the protective cover straight off the needle. Gently invert the syringe to maintain a uniform suspension and tap the syringe to remove any visible bubbles. The reconstituted Sandostatin LAR is now ready for immediate administration. Sandostatin LAR must be given by deep intragluteal injection only, never intravenously. The injection can be given into either the right or left gluteus. To prepare the patient for administration, clean the injection site with an alcohol swab. Insert the needle fully into the right or left gluteus. Slowly draw back the plunger rod to check that no blood vessel has been penetrated. If a blood vessel has been penetrated, change the needle position. Using steady pressure, slowly depress the plunger rod to inject the entire dose. Then, withdraw the needle from the injection site. Once the injection is complete, activate the safety guard on the needle using a single-handed technique. This can be done using either of 2 methods. For the first method, Press the hinged section of the safety guard down onto a rigid surface, such as a table. Alternatively, you may push the hinge forward with your forefinger, taking care to keep all fingers behind the needle tip. An audible click confirms proper activation of the safety mechanism. With the safety mechanism activated, immediately dispose of the vial and syringe with needle attached into a sharps container or other rigid closed disposal container. Proper technique can help ensure that the medication reaches the muscle with less discomfort and risk. Palpating bony landmarks is a precise way of locating the injection site and avoiding damage to the sciatic nerve. Palpate the posterior superior iliac spine, or PSIS, and the greater trochanter, or GT. To pinpoint the injection site, draw an imaginary line over the buttock from the PSIS to the GT. The injection site is along this line, within 2 to 3 centimeters above the midpoint and not more than 10 to 12 centimeters from the patient's midline. In patients with thicker adipose tissue, such as women and/or obese patients, apply skin compression to decrease the distance from the skin to the muscle and help ensure that medication is delivered to the muscle tissue. Conversely, in patients with loss of muscle mass, such as older, debilitated or immobilized patients, pinch the skin to raise the underlying muscle tissue. This is done by gathering tissue between the thumb and forefingers. In addition, the ventrogluteal site is often preferred over the dorsal gluteal site for patients who have lost muscle mass, as it typically has more muscle for safe IM injections. Injecting at a 90-degree angle helps the needle to reach the muscle by taking the shortest path through the adipose tissue. Sealing the medication by using the Z-track technique is recommended to help ensure that the drug stays in the muscle once injected. To do so, displace the skin by 2.5 to 3.75 centimeters laterally before puncturing. Release and apply gentle pressure immediately after withdrawal of the needle. Thank you for watching this video. I hope you are now more comfortable administering the Sandostatin LAR diluent formulation. If you have any further questions, please speak to your Novartis representative.